That is a very important topic. There are the first changes, it's the ones related to food, drinks, intake, and there are several details that are important, even with the standard healthy foods that need to be addressed. So to start with the immediate environment, food, drinking, then to the extended environment, her house, her working environment, all of the information that we can give and provide to the pregnant lady can help to achieve a successful pregnancy and can also avoid a lot of preventable suffering in the future. So it's really important to have that information to do the best for the baby, for the pregnancy and the couple. It's really, really useful information. Well, that is a very good question. Yes, there are lots of papers published in very good journals that show the importance of vitamins and supplements, first for the pregnant lady and also for the baby. And in that respect, indeed, there are lots of several evidence to show, ideally, we can do a blood test, check whether, if there is any deficiency, and in that case, even the standard vitamins or minerals or supplements may not be enough, and to optimize the situation and that pregnancy, so that everything goes as good as it can be, a blood test to ascertain the levels of vitamins and minerals can be very useful. If that is not possible, at least to go for the standard vitamins and supplements. That is what the Royal College also advises. Yes, there are several factors that, first I would say the factors that should be in place to make everything possible for the best outcome. And in that respect, so to be prepared in terms of what we spoke about vitamins, about the food, the proper eating, drinking. We know that there are even Shitala syndromes that are caused by the intake of the mother certain substances, alcohol, so all these, or even other substances that are common, and sometimes people do not realize that they can be harmful to the baby, like skin creams, or so all this information in a first appointment can be of extreme value for the success of that pregnancy and the well-being of the pregnant lady, and as I say, the happiness of that situation. That is, again, I think it's a very good point, because although the standards and what the governments can offer and recommend is one thing, the ideal situation is, in my opinion, to speak with a doctor as soon as you are starting, as you think about getting pregnant. So the amount of information that you can get can be so good for you and for your baby is really worthy to have all that information to maximize that everything goes as best as it can be. So as soon as you are thinking about planning your pregnancy, that is the ideal time to book an appointment and to be to have the full information that it's so useful. The first fertility appointment, here we have to divide in two parts. One is the couple that is starting to think about their first baby, and there has been no problems, and the other part is the couples that are having issues. So lots of times in my practices, couples come to me after several failed, after several miscarriages, after several problems, after lots of suffering that could be preventable with a first appointment. So in first appointment, we collect the history of both the woman, the lady, and her partner. It's really very important. So because sometimes, let's say about the situation of the partner, there may be issues related to his work, for example, that may affect the quality of sperm or lifestyle. So we go for all the aspects of the style of life of the couple, both of them. It's very important. And then I will target we can do at first appointment all of the battery of tests to make sure that all is well, and in that case, very good. Or if there is anything that is not at optimal level or is not well, there are steps, there are medication or strategies that we can put in place to bring these abnormal things into normal levels, and so work together to achieve a successful pregnancy that goes to the end.